everybody.
How are you? Today's video is titled Tips for a New Nursing Student. Before we get into that, some of you may be wondering where Olu is right now. She's in a class, but we decided to go ahead and record a video anyway because we don't want for you to get familiar with always seeing the three of us. There may be videos where it's just one of us, but that's okay. We're still working together as a group. Now, let's get into these tips, right? First tips, forming a study group. One of the things you need to know is your partner, the people that you want to be in your study group. And it's more than just knowing their name. Get to know what their grades are usually like in class and previous classes from before. Also, you want to get to know their study patterns. It's always best to choose people in your group who have similar studying patterns to you. It does not have to be the same, but the closer the better. And lastly, when it gets to knowing your partner, are they a supportive, positive person? Nursing can be very stressful, so you want to make sure you keep the right people around you at all times, and that includes the people that's in your study group.
Oh, yes.
Next thing as it relates to study group, make sure you create a schedule that's effective for everyone within the group. Make sure everyone can be able to attend because it is a study group and it is very important that everyone is always there for the most part. And when it comes down to material, we suggest that you divide your material, meaning if you're going to be using question books in your study group, don't buy all the books, divide it. Like for example, I purchased F.A. Davis question book, you had Med-Surg Success, and Olu had Mosby's. We saved a lot of money and we were still able to practice questions from all three books. Notes. Highly, highly recommend that you review each other's notes at the end of class because sometimes people are better at taking notes than others. And lastly, outside resources. When you're learning things, especially like a procedure, especially if you're a visual person, you may not be able to comprehend it if you cannot see it. So what we do is require that someone look for a video, and when they found the perfect video that explained the procedure the way closely as possible to what you learned in class, because there's different ways to do the same thing, right? So when someone found a video, they were responsible for emailing it to the rest of the group.
Oh, yes.
So that's forming a study group. The next tip we're going to go into is
the must-have.
Right.
So the basic must-haves that you must have for starting nursing school: drug book, a very good drug book, Lippincott or Davis, F.A. Davis. Second, you want to have a good stethoscope, Littmann to be exact. Littmann, you can hear everything clear as a bell.
Yes.
Ooh, yes,
it's a difference.
Yes. But if you cannot afford a Littmann for now, maybe you want to invest in something a little cheaper. But make sure you get the stethoscopes that have the one tube, not the two tube, because the two tubes is too thick for you to hear everything. It's going to give you like a dull sound for everything that you're hearing. Not good. Also, you want to make sure you have a good comprehensive book like Saunders, just so you can break down whatever material that you cannot actually understand in class. Also, you want to make sure you have a secondhand watch, which
we never have on us now, but in clinicals we do.
You better have it. Also, you want to make sure you have a pen light so you can do your neuro assessment, Perla, you know,
check the eyes. Right.
And that's pretty much it. That's the basic
must-haves.
things that you must have. There's other things, but
yeah, we're not going to get into all of it. The next set of tips we're going to talk about relates to clinicals, especially if it's your first day ever on clinical. We highly recommend that you go over basic skills that you learned in class. Some of them may include taking vital signs. We did do a video about manual BP. Check it out. Administering PO medications, bed, bath, and bed making, basic med math questions, and so forth. Whatever you're pretty much responsible for knowing in your fundamentals class. Make sure you review the skills and ask your school if they have any videos. I know our school has Mosby videos, so we didn't have to pay for it. It was something that was given to us for free at the school. We could watch it. Another thing I want to bring up is fear. Don't be fearful. If you don't know something, ask. And we recommend that you ask your instructor, not just any nurse, because nurses have different ways of doing things. Your clinical instructor may want it one way. So definitely speak up and ask if you're fearful. Next set of tips goes to.
The next set of tip would be to change your mindset. So you want to mentally prepare yourself for the upcoming challenges. You're going to get so much papers. You're going to get a lot of material.
Yes.
I mean, our first semester we had a binder that looked like this. No lie. So you want to mentally prepare yourself to be overwhelmed. You're going to yell at your friends. You're going to yell at your family. You're going to yell at your boyfriends. Like, you know, it comes with the whole packaging.
Right. It's just stress.
it's stress, but you basically got to tell them, look, I apologize, but you know I'm under a lot of stress. I got to do what I got to do. When I'm done, we could do whatever. We can hang. We could go to the do the whole 9. Pretty much it. But also you want to make sure you have a good support group by your side. Your study group, whether it's your mommy, your daddy, your friends, whomever. Make sure you have a good support group, because you cannot do this by yourself. It's not a one-man army. You need like 2 or 3 people
to work together.
You know. That's pretty much it.
Next set of tips will be studying. This goes more to people who take the independent route of studying. Highly recommend again that you create a schedule. You're more likely to stick to it. If you just say, yeah, I'm going to study next week, you're probably going to forget and not stick to what you said you were. So definitely write it out. Next thing would be to, sorry, my allergies are acting up. Try different methods. You'll find that when you were in prereqs, studying for prereqs is completely different from studying for nursing, and that's okay. Think outside of the box. If that means acting things out, that means calling one of your study partners and discussing it like you're talking about an actual patient, creating acronyms, creating songs, whatever you have to do, no matter how silly it may seem, get it done so that you pass and you actually understand what you're learning.
Oh yes.
Take breaks. We recommend that you take a 5-minute break after 20 minutes of studying. Some people may say, I don't have to do that. That's fine, but some people may spend 5 hours reading straight, and then they get the chapters done. They're so excited, but they didn't retain the information. You don't want to be like that. So definitely take breaks and oxygenate your brain. Read before you get to class. You may not be able to read everything, but try to get familiar with what your professor is going to be talking about in class, so that when you're there, you're not completely lost, and you get a feel for which direction your professor is going to be going with this whole topic. And lastly, as it relates to studying, no cramming. No cramming. As soon as you get the materials for your upcoming exam, create a schedule from day 1 to the day of the exam, putting down exactly what you want to tackle. That's exactly what I did, and Samantha did the same thing too. So we were really organized. The people who wait 3 to 7 days, God bless you. Like, don't do it. You may pass your exam, that's great, nice, but will you remember all of that information? Well, no one really remembers everything, but you know what I'm trying to say. Don't cram. Don't do it. Okay, next topic.
Lastly, take
care of yourself.
Pray. Exercise. Eat. Sleep.
Eat and sleep.
Hang out. Not too much.
Yeah, don't do too much.
And laugh.
Don't laugh like that. Don't laugh like that.
But laugh, you know, but not too much. No,
laugh a lot.
Yeah.
We laugh a lot.
That's gonna keep you sane.
It does.
Yes.
It works.
And that's pretty much it, guys.
Yes.
If you have any comments, please
leave them below. Any recommendations?
Yes.
Leave them below.
Subscribe, like,
and comment.
Bye,
Bye, everyone.